This segment is sponsored by Rockford Family Eye Care. More than 30 million people suffer from chronic dry eye. It can be caused by a number of things, including weather, age, environment, allergies, maybe wearing contact lenses, excessive eye strain, and a whole lot more. But how do you know for sure? And how is the discomfort treated? Dr. Theodore Sees joins us now from Rockford Family Eye Care to talk about everything you need to know about chronic dry eye. Good morning. Good to have you here.
Thanks for having me.
So what is this dry eye?
Well, dry eyes is a chronic multifactorial disease of the ocular surface and tear films, which results in symptoms of discomfort, visual disturbance, and tear film instability, which can cause damage to the ocular surface. Now, there's many different reasons why someone gets dry eyes. Like you said, could be environments, medications, medical conditions, genetics, and even age and gender play a role.
So, and then the way that it plays itself out, you mentioned some of those things, like a lot of, it's funny because it's called dry eye, but there can be a lot of tearing that comes with it, right?
Yeah, actually one of the symptoms of dry eyes is actually is watery eyes. So, but people don't realize that. Yep. So, you know, it's one of the most, besides blurry vision, it's the most complained about issue that patients have when they go to see the eye doctor. Like you said, it's estimated that 20% of Americans have chronic to severe dry eyes, while an additional 30 million Americans have just the mild dry eyes. As we get older, unfortunately, dry eyes comes with age, and it's a little bit more prevalent in females than it is in males. Like you said, with soft contact lens wearers or people who have medical conditions like diabetes or thyroid disorders, or even autoimmune disorders like Sjogren's, lupus, rheumatoid arthritis, those people tend to suffer from dry eyes as well. People who take certain medications, whether that be antidepressants, allergy medications, or even hormone replacements.
Yeah. You've just described most of the people on the earth. You do know that, right?
I know, right?
So the tearing is part of it. Correct. There can be a lot of bloodshot eyes.
Yes, yes.
Even a feeling like there's something gritty in there, right?
Right. So some of the more common symptoms of dry eyes include redness, scratchiness, burning, stinging, foreign body sensation. But some of the less known complications are fluctuating vision. That's a big one. Watery eyes, tearing eyes, itchy eyes and tired eyes, and sensitivity to light too.
We are looking at video right now of a treatment called MIEBO. This is something new. Tell me about what he's doing.
So MIEBO is a non-medicated approach to treating some dry eyes. One of the main culprits of dry eyes is the tear or the eyelids are not producing a nice olive oil layer to help protect the eyes. And what happens is those glands get plugged, and so what we do is we do a heated massage for the eyelids, and it opens up those glands, helping to secrete that nice olive oil protective layer.
Okay, so that is MIEBO.
Correct.
And then there is another treatment.
Yep, it's called Blefx. Blefx does a really good job at just kind of scrubbing away the top or the top layer of the eyelid margin, because what can happen is you can get some cellular debris on that margin, and it can cause some of that scratchy, itchiness, irritation feeling, which is another symptom of the dry eyes.
We are watching it being done here, and we have to mention that prior to this, because it looks a little
yeah, it looks
hard to watch.
Intense.
He's been numbed with
yes,
numbing
no,
drops.
There is no sensation at all. It doesn't actually even touch the eye. It's just on the eyelid margin, but we do put a numbing drop in just for patient comfort.
So you go back and have both of these treatments done from time to time? Is that how it works?
It just depends on the type of dry eyes that you have. There's many different types out there, and each type kind of determines the treatment. What we like to do at Rockford Family Eye Care at our dry eye center is we kind of like to take it at a more conservative approach medically and financially, because if we can fix the problem with a good artificial tear and a good omega-3 supplementation, then we've saved our patients a lot of money on unnecessary medications and treatments.
Yeah.
But we are licensed to prescribe all the dry eye drops that are out there, including Restasis and the new dry eye drop that's called Xiidra. But we also can do other drops that are formulated from your own blood, formulated from human placenta, and those do a really good job too. There's other things that we can do as well. We can put plugs in the drainage system of your eyelids to help prevent your tears from draining too quickly. Or we can even put tissues on the eye that are made with amniotic tissue to help heal the damaged cells from dry eyes.
All right, well, we have put contact information for Dr. Sees and Rockford Family Eye Care on our website. Go to WZZM13.com under the exchange. Good to have you here.
Thank you.